What are the risks of caffeine addiction during breastfeeding? Have you ever wondered how caffeine affects breastfeeding? Caffeine addiction might not be as widely discussed as other substance addictions, but it can present risks for both mothers and their babies. Caffeine is a common stimulant found in coffee, tea, chocolate, and even some medications. It works by boosting alertness and energy levels. However, too much caffeine can lead to dependence and addiction, which is important to consider during breastfeeding. When a breastfeeding mother consumes caffeine, it does pass into breast milk, but only in small amounts. Typically, a breastfed baby receives about 1.5% of the caffeine consumed by the mother. For most breastfeeding mothers, moderate caffeine intake is generally considered safe. This means consuming less than 300 milligrams of caffeine per day, which is roughly equivalent to 2 to 3 cups of brewed coffee. Despite this, there are some risks associated with caffeine consumption during breastfeeding. One major concern is that infants, particularly those under 6 months old, may be more sensitive to caffeine. Their slower metabolism means they process caffeine differently than adults. This sensitivity can lead to increased heart rates and irritability in some babies. Another risk involves sleep disturbances. While adults often experience sleep issues with caffeine, babies can also be affected. If a baby is sensitive to caffeine, it may disrupt their sleep patterns, leading to fussiness and difficulty settling down. Caffeine addiction can also lead to withdrawal symptoms if a mother suddenly stops consuming it. Although caffeine addiction is not as severe as other substance addictions, it can still pose challenges for mothers trying to manage their intake while breastfeeding. To minimize risks, mothers should keep track of their caffeine consumption. This includes being aware of not just coffee and tea, but also energy drinks and chocolate, which can contribute to overall intake. Observing any changes in the baby's behavior is also important. If a baby seems fussier or has trouble sleeping, it may be worth considering the mother's caffeine intake. If there are any concerns about caffeine consumption and its effects on the baby, consulting a healthcare provider is a good idea. They can offer personalized advice based on individual situations. In the context of substance abuse and addictions, caffeine addiction is often viewed as less severe than other substances. However, managing caffeine intake is still important, especially during breastfeeding. While caffeine can be safe in moderation, being mindful of its effects is key to maintaining a healthy balance for both mother and child.